have been a primary care doc for over 30 years now, and I gradually, because of the type of doctor I am, I do both internal medicine and pediatrics. My friends who were pediatricians who took care of children with complicated illnesses found me to be the right person to transfer people to. And so I started to accumulate, attract a group of patients who had significant disabilities. And as that started to increase in number in my practice, the ability for us to accommodate those patients in a busy practice became more difficult. I was working on a project with the School of Medicine pediatric residency on improving training of pediatric residents in working within their communities. And as a consequence of that, we were partnering with a variety of organizations, one of whom at the time was IPIN, Indiana Parent Information Network, now ASK, About Special Kids. And as a consequence of that pairing with that organization, we started talking about family-centered care and transition needs and the specific needs of people with disabilities. And we realized that that organization and my organization were both interested in thinking about how to improve services for transitioning youth with disabilities. So we learned that Maternal Child Health Bureau federally, as well as Title V, were interested in this as a project, and they had started funding that now 17, I guess, years ago. And they were ready to start a second round of thinking about improvements at a state level, and we got involved, IPIN and me, got involved talking to Maternal Child Health here in Indiana, and they funded us to do a little bit of pilot work in terms of thinking about what do we need. And we went around and talked to a number of the Centers for Independent Living about what the needs were in our state. So as a consequence of that, we were able to put in a pilot funding requisition to Title V here in Indiana, and we were funded to start building transition services. When we started building transition services, we thought people would come to see us with a variety of different types of healthcare needs. But in fact, sometimes when you build things, you don't know who will come. And when we built this, the people who actually came were people with in much higher proportion to their representation in the population, people with intellectual disabilities and physical disabilities. And so then, just by happenstance, I started doing more and more of that work. I trained in the late 70s, early 80s, and so there was very little specific attention to the actual work I end up doing in my career. We did a lot of training in the hospital on people who are very sick at bedside, which is very different than caring for people in home and in community. And most of that I found I had to learn myself by being thoughtful about my approach and reading what literature there was, and I guess I would describe that as a self-taught process. I think there's better methods today than there were in the late 70s, but that was the truth then, that you kind of had to figure it out. Indiana University School of Medicine is in now the beginning of year 3 of launching a new curriculum that integrates different parts of science together in efforts to improve the learning experience for our future physicians. Part of that new curriculum has an interprofessional education curriculum so that people are working together with people who are also entering the field in other professions. So that's one of many enhancements. A second is that we're creating a thread of disability education through the 4-year medical school training that starts with the culture of disability and the rights of the person with disability onto how do you actually apply that into your clinical service delivery. And I think we'll see evolution and an improvement, I hope, in the readiness of our graduates in caring for people with disabilities. There are still small organizations nationally in the U.S. that are trying to work on improvements in both medical and dental training around people with disabilities. And so I think we have some forward momentum in the last 10 years in this area, but still plenty of room for improvement.